Welcome to Payments Playbook, the show where we explore the strategies and systems that drive smarter payments, stronger cash flow, and more profitable business. Brought to you by Paylink, the business-to-business payment experts. Now let's dive into today's episode. For today's episode of Payments Playbook, we have Michele Bolton with MY911. Welcome, Michele, and thanks for being here.
Oh, thank you so much, Paul. I really appreciate you having me on today.
Oh, absolutely. So why don't you give us a little background of why you started My911 and your background as well?
Okay, sounds good. My background is actually started with farming, believe it or not, and morphed into the wealth management side with a firm here in Canada, CIBC Gundy. And then I transitioned out of that into My 911. And My 911 was really a calling upon me. It wasn't something I went looking for, but initially I had a lot of healthcare issues in my 20s, starting at age 23 with an emergency surgery, and then ended up having two other emergency surgeries um, within my 20s as well, and on top of losing my father when I was 25 years old. So
Too bad.
yeah, he was 53 and he had a massive heart attack. So it was very unexpected. Obviously, extremely devastating to everybody in the family. So I went through those, three different surgeries. And then when I was 30, I was diagnosed with teratoma, which is it was a very large embryonic tumor in my chest. So
Wow.
I initially went in thinking I had a cold or bronchitis because I couldn't breathe climbing a flight of stairs. So when I went in, they said, "Well, we think you've got a bit of a heart murmur. We'd like to do a chest X-ray." So I said, "Okay, no problem." And when they took me in, and he came back about three of them, I guess, diagnosed it. But about 15 minutes later, he came back and said, "The three of us feel you may have Hodgkin's disease."
Oh, wow.
And I didn't know what that was, Paul. And I just
Yeah.
said, "Well, what's that?" And he said, "Cancer." So I broke down and he just said, "Come here, I want to show you something." So when I went into the x-ray room, all I saw was this, massive image of pure white he's like, I said, like, "What is that?" And he said, "That's a tumor.
Oh, wow.
And we should be able to see your heart and your lungs and your organs. We can't see anything." So he sent me to a thoracic surgeon, Dr. Richard Inculet, which is an amazing surgeon. Saved my life, obviously, and he said we had to do open heart surgery to remove that. But it's everywhere, absolutely everywhere. And my biggest concern at the time, being 30, vanity, like, well, I'm gonna have another big scar right on the middle of my chest. And he just looked at me,
Right.
"Michelle, I don't think you understand." And I said, "Well, what are you talking about?" He said, "I don't know if I can save you."
Oh, wow.
So it is devastating when you expect to get antibiotics and go home and continue on with your life, but that wasn't the case. So it was life altering for me having that surgery and getting through that. It totally changed how I looked at everything in my life and the world itself. So fast forward to 2018, you keep going on, right? And
Yeah.
they started screening me for breast cancer. And so I was going in every 3 weeks, and the same questions kept appearing every time I went in. And I think at that point, I just was so frustrated, Paul. And I just sat there terrified again, worried about my health, not about answering their questions. And
Right.
they have to have the answers. They need the information so they can help you. But I was just more worried about my health at the time and panicked again after all I'd been through already. So I just thought, there's got to be a better way to do this. So I went home and I designed our wallet cards, customized wallet cards for
Excellent.
healthcare. Yeah. So they display a QR code on the back that links to your online emergency profile, and you can update your information in real time as your health changes. So each one of us, obviously has a very different medical profile. And it's very empowering to
Oh, you bet.
give people control over their healthcare information again. Yeah.
Yeah, actually, regarding that wallet card or medical card, do you have that just where you could just show it?
Yeah, so we've created customized wallet cards for healthcare. This is a
Okay.
sample, of course, of the card people will get and people get. And then on the back, it displays a QR code, and that code is much smaller now than it was originally when I started the service, but you can list the information that you want directly on your card, and what's not listed on the card itself is behind that QR code. So
So the process is if you scan that QR code, you can put in whatever information you so choose. Is that correct?
correct, correct. So when people register, they go to the website. In Canada, it's my911.ca, and in the United States, it's my911life.com. And they would register and go through the payment process like purchasing anything else online. And then once they've done that, it creates an emergency profile for them. So when they log in, they'll have their own dashboard, and then they just start editing their profile. And that's where they enter all the information around their medications. Maybe there's family history, past surgeries, underlying conditions, and allergies. And, some people even put in their, specific instructions as a caregiver for a
Sure.
patient if they're taking care of someone. It's typically around the questions you're constantly being asked that you don't want to have to repeat yourself. And you want to make sure the information is clear and accurate. So that's the information they're putting in, if it's medications or supplements they're taking. Anything that you want that you feel is important for you, that's where the empowerment really is you get to control the information you're sharing and who you're sharing it with. So
And do you have like emergency contacts too?
absolutely. Right on the front, you can share, a couple of emergency contacts. You put your doctor's name or a clinic and the phone number. You can enter your blood type if you know what that is, your blood
Yep.
pressure, those sorts of things. Just the immediate, if you have an EpiPen that you need, just really, really triage kind of information. And you can then go as deep as you like. But if there's perhaps something too sensitive that you don't want to share, that's your choice. You don't have to put it in there.
You have, I don't know what they call them, a life directive. I don't think that's the right term where
Um,
do not
a
resuscitate. Do you
DNR,
what
I
are?
haven't gone that route quite yet because that requires, I think it definitely requires paperwork for
Oh,
them to
absolutely.
see. So I haven't actually put that on the card, but I've got a wish list of items that, people obviously want to add in. So, I tackle those as well. When
You
there's new
bet.
updates. So I just try to customize things to make the user experience as seamless as possible, keep it really efficient and easy for them. It's all about keeping it simple, right?
Yeah,
Um,
absolutely. So they use it.
yeah, yeah, exactly. And, it's helping others help you because, if something happened and, you and I were in the same room, perhaps instead of Zoom, and something happened to me, you wouldn't know what medications I was taking. You wouldn't know what I was allergic to, right? So
Absolutely.
it does help other people help you and provide, incredible peace of mind for families because,
Absolutely.
they can't even speak for each other. I don't think, if they're on a vacation somewhere out of town and something happens, how do they know, right? If
Yep. No,
something
I agree.
yeah, it can be very empowering for families as well. But again, it's all about, first making sure it's wrapped around the privacy and security and compliance and regulation around healthcare. That's obviously critical and certainly it's our number one value is to make sure that, we're making sure we're safeguarding the data and
Right.
protecting everybody to the best of our ability that way. So, obviously we share tips and tricks for best practices, don't use public Wi-Fi when you're obviously entering your information. Make sure you have cybersecurity software on your computers that you're using and your phones. And I think that language is really important for people to understand.
Yeah.
Don't share your password with somebody else unless you want them to manage your profile for you.
Right.
Just those little things, I mean, they're little, but they're big, right? So
Yep.
it's critical that people are careful. And, I can only do so much from my end to make sure that we're doing what we need to do.
Right.
But the end user, the patients, the caregivers, they have to make sure they're not sharing passwords with people they don't really want to see or have control over their profile.
Right. Well, one question I was just thinking about it, it's QR code based. Do you allow for people to put a QR code on their phone, or is it strictly with the card?
It's strictly with the card.
Okay.
It's absolutely strictly with the card. It's specially designed to be identified with that profile. So that's a great question, Paul, because let's say someone lost their card, right?
Yep.
They can deactivate the QR code with a click of a link beside their profile, their emergency profile on their dashboard. But
Nice.
if they found the card again, if they thought, oh, I just misplaced it in the house or something, and they found it again, they can reactivate it.
Nice.
But if someone absolutely loses their card and they don't know where it is, then the best practice would be to A, deactivate that QR code right away,
Yep.
and B, order a new card to replace it. And when they do that, it will also generate a different QR code, right? For privacy
Sure.
and security.
Sure.
So, yeah, there are unique identifiers with that emergency profile for the individual. And they are protected obviously through the dashboard. And people do have a lot of flexibility whether they want that QR code online or offline.
Okay. Very cool. You built the platform from the ground up. What were some of the challenges with that?
Oh, there were many. There were many, I'm not going to lie there. It was well, initially, because I never really started this, Paul, as a business, I just wanted to, get rid of my own frustration. I was so upset, and then when I got thinking about it, I thought, "Well, there must be other people that are equally as frustrated," right?
Right.
So, at the beginning, there was no blueprint. There's no roadmap to follow if you're, kind of copying somebody else. There was none of that. This was not there. And so we did have to really I had to get a good web developer, which I have, thank goodness. And, he's had a lot of experience in the caregiver world himself, so he understood and is very passionate about, this project.
Yeah.
So there was a lot of different challenges because there's a lot of different regulations that we had to kind of look through and make sure that we're meeting the criteria. Um, so there was definitely just different challenges along the way of because when you're giving every individual member their own access and their own control, that's another layer of complexity. So,
You
yeah,
bet.
there was just mostly technology for sure, because it's constantly changing. And then, I think a bigger challenge too is around education and helping people understand how this works because it's so new.
Right.
And when you are building from the ground up, you're building trust. You're, continuing on building relationship, but there takes, technology is technology. And, obviously, even some of the largest companies have glitches. But,
Oh,
you
absolutely.
know, we're on this every day. And we've worked in the middle of the night at times, up at 3 in the morning online working together. So, we're adamant about just making this the best platform out there and the most trusted provider in streamlining medical communication. So it's a huge commitment. Obviously, I jumped in 100% with both feet to do this work. It called me. And there've just been a lot of challenges, even around, the amount of money that goes into something like this. You certainly don't anticipate at the beginning.
Oh,
You just
right.
don't know what you don't know, right? So,
Exactly.
I've put a lot into this and my heart and soul on top of it. So I'm very proud of it. And I am very, very blessed to have an incredible team around me, both in development and support and, manufacturing. It's been amazing, really. I'm very,
Excellent.
very, very, very grateful.
And as you know, well, as you're finding out, anytime you develop a technology, it's a black hole. It's never ending. You're continually
Yeah.
updating, enhancing, fixing, etc.
Yeah, that's right. That's right. But when you know what, when you see the end result and you get to when I got my card in the mail, I start crying. It was, happy tears, obviously, but it was really emotional because you had just have this little idea in your mind thinking, oh, this, little no problem, right? But
Yeah.
bringing it to market is a completely different animal, so much more challenging and difficult than I ever expected to do. But when you do get the final result, there is incredible satisfaction with that. Like
Oh, yes.
it's
And you can tell you're passionate about it.
yeah,
Let's talk about the business model a little bit.
yeah,
Is it a subscription based or what kind of business model are you
it is.
incorporating?
Yeah, no, it is a business model around a subscription, obviously. And so people can choose when they register to pay either monthly or annual.
Okay.
Instead, if they just want one payment up front or if they want to pay every month due to cash flow. So, obviously it's pennies a day either way for them. But it is, it gives them flexibility. There's no contracts involved. There's no cancellation fees, and people can pause it or reactivate it anytime they like. Because
Nice.
I did come at this from a patient perspective, and in other words, what would I want
Right.
as a user, right? What would I want as a patient? And I thought, you have to be, healthcare is personal for people. And if I all of a sudden just wanted to, suspend it for a little bit, pause it, then I can do that. But if I wanted to
Okay.
reactivate it, I reactivate it. The only caveat to that is if you pause your subscription, then what happens is the QR code is not active either. Like
Sure.
it'll block access, right?
Yep.
So that's the only thing is,
Yep.
you have to pay for it because it's not obviously it's not cheap to store data and to safeguard that. So yeah, so that's but I came at it from a patient perspective. I wanted to make sure that I was putting myself in their shoes with every decision I made, you know?
Yep.
And that was really important for me because that's why I started this, was I
Okay.
wanted a good experience myself.
You bet. And since I'm in the payment acceptance space, what technologies are you using for processing the payments?
So right now I'm using Stripe
Okay.
and, obviously they're a huge payment processor throughout the world and they have rigorous compliance and regulations they have to abide by as well. And again, it was all building that foundation of compliance and regulation and privacy and just going through the hoops to make sure I was using the best I could use to safeguard data. And,
Sure.
and especially with Stripe, I don't store the data. I don't have access to the data, to anybody's financial information. So that's a good thing for liability reasons, obviously. But I think it gives people peace of mind knowing that it's done through a regulated, highly regulated industry.
Yep.
Um,
Well, and Stripe, they've done a good job. They've made it easy to integrate with.
yeah,
They've done a good job.
yeah, I think so. They've done a really good job. I haven't had any issues so far. So it's been a great experience with them. Yeah.
Regarding markets right now, you mentioned you're in Canada,
Mhm.
but you also have launched in the United States. Is that correct?
We have in Florida as our test market because there's a lot of seniors in Florida, obviously, and
You bet.
it's a great state, obviously, to do business with. So I just thought there's a lot of Canadians that typically go down. Snowbirds are traveling all the time. A lot of cruise ships leave from Florida ports. Just different things like that you think about when you're kind of launching. And so yeah, I chose Florida for multiple reasons, actually.
Yep. Are your plans to bring it across the United States or roll it out or operate right out of Florida for the rest of the United States?
No, I mean, I can really do business anywhere in the United States. It's just a matter of making sure that, if anyone does purchase from another state, we have to make sure. I think right now I've got it set just for Florida, but if they did, then, obviously the privacy policy and terms and conditions need to be changed to accommodate their privacy policies because
Oh, so you have to do that for each state.
every
Oh, wow.
state, it's like dealing with 50 different countries. Yes, they
Wow.
each have their own regulations on top of the federal regulations. So we have to make sure that we are complying with all of the different states.
Okay, so that's a little management.
You know what? I've had a great team of lawyers down there and they know their stuff. They just deal in healthcare 100%. So I feel good about that. And I've already had those discussions with them. And yeah, it's not a problem. It's not a problem.
Wow,
So
very cool,
yeah,
very cool.
yeah, very exciting. Very exciting. It's a big market there. So
Well, it's a big market everywhere because I mean,
mhm.
I just went to the doctor yesterday, and you're right. They ask you the same questions. You know what? I don't remember the medications I'm on or any of that stuff. And if I actually had the app, I could bring it up and just show them here's what I'm doing or have or whatever.
Exactly. And it is about keeping it simple, right, Paul? Because maybe there's
Absolutely.
information you don't need to share with them. It's redundant, or it just even wouldn't be applicable in the situation you're in when you go to see them and speak with them. But if you've waited for a month, 2 months to go see a specialist, maybe even more,
Yeah.
certainly longer here in Canada, I know that. And then you finally get there and you're trying to catch them up on your family history or other issues. There's a lot of time that can be wasted.
Oh, you bet. Why, and you're under distress too, and
Yeah.
recalling or remembering everything. It's tough.
You know what? It's extreme, a lot of anxiety around that for sure.
Oh, absolutely.
Yeah.
Well, Michelle, thank you very much. How do people find more about My 911 and how can they get a hold of you?
Oh, thank you. They can just head to the website, my911.ca in Canada. And in the United States, it's my911life.com.
Okay.
And they can contact us through those websites and it'll come direct to me. And then, yeah, or they can, I guess they can go onto our social media as well. We're on obviously LinkedIn and Instagram, Facebook, X, and Threads as well. I've just launched my TikTok, but I haven't really done too many videos for that yet. So I'm not quite there on the TikTok. But yeah, so and then I have a YouTube channel as well. So yeah. So anywhere through
Excellent.
social media, we encourage everyone to follow us, sign up for our newsletter in Canada and we'll get that going in the United States shortly as well. But yeah, no, it's pretty exciting. Very, very excited to serve the United States. So
Excellent. No, it's a very valuable service, and I think you found a niche here.
thank you so much. Thank you. I
You
appreciate
bet.
that.